It's Victoria Smart, and today we're going to be assisting a patient with feeding meals. First thing I'm going to do is gather my necessary supplies and equipment. I'm going to perform my hand hygiene and provide for patient privacy. I'm going to verify the healthcare provider's orders and introduce myself to the patient and family if present. I'm going to ask the patient to give me their full name and date of birth and compare that using two identifiers on their wristband. I'm going to assess the patient and ask them about if they're experiencing any nausea, if they have the ability to pass gas or have an intact gag reflex. I'm going to check the condition of the patient's teeth and dentures, making sure they're properly fit. I'm going to check all four quadrants of the stomach for bowel or abdomen for bowel sounds. And then I'm going to assess and ask the patient's ability to feed him or herself and what their appetite is like if they're hungry. Next, I'm going to prepare the patient's room for mealtime. I'm going to clear their overbed table and help the patient into an appropriate and comfortable position. I'm going to help the patient if they need to void or eliminate before the meal begins if necessary. And then I'm going to help the patient put in their dentures, put on their glasses, or insert contact lenses if needed. And then lastly, perform hand hygiene for the patient. Then I'm going to verify that the food that they ordered is the correct for the patient and it's what they wanted and what they ordered is delivered. I'm going to ask the patient if in what order they would like to eat their meal and ask them if they'd like any desired seasoning or lemon wedges or if they need the food cut. And if the patient is hard of seeing or has dementia, I'm going to use the plate like a clock, telling them the green beans, say, are at 2 o'clock, making it easier for them to find. Then I'm going to identify the food placement and feed the patient in a way that helps facilitate chewing and swallowing with ease. I'm going to ask the patient and provide fluids if they would like during their meal, but encouraging them not to drink all the fluids at the beginning of their meal. Then I'm going to talk to the patient during their meal, use the opportunity to go over some education, maybe some post-operative exercises and discharge planning. I'm going to assess or assist the patient with hand hygiene after they are done with their meal, as well as ask them if they would like any mouth care. Ask the patient their preference if they would like to get back in bed or stay in the chair after eating. If they would like to get back in bed, making sure that the head is elevated on the bed for at least 30 minutes to an hour after mealtime. I'm going to position the patient's bed properly, making sure it's in the lowest position, the wheels are locked, and the side of the bed that we were working on is raised. I'm going to make sure that the call light is within reach and that the patient knows how to use it if they were to need me, as well as making sure their room is left tidy with all their personal belongings within reach. Lastly, I'm going to dispose of my gloves, perform hand hygiene, and document the procedure in the patient's record, recording the calorie count and fluid intake of whatever they were eating, as well as showing in the documents whether there were any swallowing difficulties or refusal to eat.